Good morning. Right. Good morning. Today we'll be having a class. Okay. So, before we get into the class, I want you to ask what do you think about this image? So, what's the, this is, you could identify by looking into this image. And what's the disease typically presents itself in this pattern. Okay, so let's move on to understand what the first image shows. The first image is about measles. Okay, measles is an acute, highly infectious disease of childhood caused by a specific virus of the group myxovirus. So, now coming on to what is the problem statement, that is, in 2015 there were around 1,34,200 measles deaths globally, about 367 deaths every day or 15 deaths every hour. So that's how huge was the problem then. So measles vaccination resulted in a drop of 79% in measles death between 2002 2015 globally. Coming to epidemiological features, right? The first thing is agent factors. In that, the first point is agent. So measles is caused by an RNA paramyxovirus. So far as it known, there is only one serotype. Okay. Now coming to the next point, that is source of infection. The only source of infection is a case of measles. Carriers are not known to occur. Okay, so what is the next? Next one, we have infective material, secretion of the nose. What else? The throat, respiratory tract of a case of measles during the prodromal period and early stage of the rash is seen as the infective material. Coming to communicability, measles is highly communicable and infectious during the prodromal period and at the time of eruption. So communicability declines rapidly after the appearance of the rash. The period of communicability is approximately 4 days before and 4 days after the appearance of the rash. Okay. So coming to the next point, that is secondary attack rate. There is only one antigenic type of measles virus. So infection confers lifelong immunity. Most so-called secondary attack rate represents error in diagnosis, either in initial or secondary illness. So as of now, it's a lifelong immunity is seen in measles. Coming to the next, that is host factors. So affects virtually, coming to the age, it affects virtually for between 6 months to 3 years of age in development. It's more highly affect, and older children usually over 5 years is in developed countries. Most of them are affected in the developing countries in the 6 months to 3 years of age. So coming to sex, both sex are equally affected. Immunity, there is no age is immune if there was no previous immunity. So first immunity is there, then okay, but if there's but however, one attack of measles generally confirms lifelong immunity. Coming to nutrition plays a very important role because measles tend to be very severe in malnourished child, carrying a mortality up to 400 times higher than in well-nourished children having measles. So nutrition plays a very important role. Coming to environmental factors, given a chance, the virus can spread in any season. Okay, in tropical zones, most cases of measles occurs during the dry season. In temperate climate, measles in a winter disease. Okay, so that's what is it about environmental factors. Coming to transmission occurs directly from person to person, mainly by droplet infection and droplet nuclei from 4 days before onset of rash until 4 days after thereafter, right? The portal of entry is the respiratory tract that you know. Coming to incubation period. Incubation period is commonly 10 days from the exposure to onset of the fever and 14 days to appearance of rash, that will take around 4 days. So, coming to the next, okay, that you understood now. Coming to the next, what is the clinical features? First is it has something called as prodromal stage. So it begins 10 days after the infection and lasts until 14 days. That is the prodromal stage. So it is characterized by fever, coryza with sneezing and nasal discharge, cough, redness of eye, lacrimation, and often photophobia. Okay, there may be vomiting or diarrhea in some cases. A day or two before the onset of rash, that is called as Koplik spots, which are spots like table salts, crystal appearance on the buccal mucosa opposite to the first and lower molar teeth. It is seen, it's a bluish white spots on the red base. It is seen as like pinheads. Okay, so second phase is eruptive stage. So in the eruptive stage, what happens is it is characterized by typically dusky red muscular or maculopapular rash which begins behind the ears and spread rapidly in a few hours over the face, neck, and spreads down the body, taking 2 to 3 days to progress to the lower extremities. Okay, that's what happens in eruptive stage. This is Koplik spots. You can see that is Koplik spots on the buccal mucosa. So post-measles stage. In the post-measles stage, what happens is the child will have lost weight and will remain weak for a number of days. There may be failure to recover and gradual deterioration into chronic illness due to the increased susceptibility to other bacterial and viral infections, nutrition and metabolic effects, and the tissue destruction effects of the virus, which may happen in the post-measles stage, which may lead to the complications, or sometimes it reverts back to the normal. But if at all it doesn't revert back to normal, there is complication. So but however, most of the times it is seen as measles is seen as an unimportant infection, but that's not true. The most common complication are measles associated diarrhea. There also been pneumonia and other respiratory complication, also otitis media. So otitis media occurs around 5 to 10 15% of the cases. Pneumonia is a most common life-threatening complication, and there is one serious neurological complication which includes febrile convulsions, encephalitis, subacute sclerosing panencephalitis, which may also lead to a lot of complications in terms of measles. So how do you prevent? How do you prevent this? So prevention of measles could be mainly by vaccination. You also know that vaccination is the only and the main event how we could prevent the disease. As you know, vaccination is given normally at the ninth month. So before we were to give MMR, mumps, measles, and rubella. So as of now, we're giving MR, that is measles and rubella virus, and and also if at all there is some higher risk of the disease, then you give immunoglobulins. These are only two ways how can you prevent the disease. Next topic is mumps. So that the second image which you saw in the initial self slides, so that is called as mumps. Now coming to the mumps. So what is mumps? So immunization currently averts an estimated 2 to 3 million deaths every year. Okay, if we don't do immunization, that means 2 to 3 million deaths will happen. So as of now we're preventing 2 to 3 million deaths by immunization. An estimated 19.4 million infants worldwide are still missing out of this basic vaccination. That's the strategy. So now coming to the epidemiological features. Again, agent factors. First is agent. The causative agent is myxovirus parotiditis. is a RNA virus of the myxovirus family. Okay, the source of infection is both clinical and subclinical cases. Subclinical cases, which accounts for 30 to 40% of all cases, appears to be responsible for maintaining the cycle of the infection. Okay, coming to infective material. So what is an infective material? All as it is. Wait, just a minute. Okay, again, it's a respiratory disease, so mainly it goes through the droplet infections. So the infected materials also would also be no in droplet saliva, secretions from the ducts are also be very highly infectious. Communicability, usually 4 to 6 days before the onset of symptoms and a week or more thereafter. The period of maximum infectivity is just before and at the onset of the parotiditis. Okay. Secondary attack rate, it's estimated to be around 86%. Okay, right. Just a minute. What I call? Okay, I'll look into that. Okay. So next is host factors. The host factor first is age. Mumps is the most frequently cause of peritonitis in children in the age group of 5 to 9 years. That's very important. Both sexes are equally affected. Okay. Uh, Immunity. One attack, clinical or subclinical, is assumed to induce lifelong immunity. Coming to a number of factors, mumps is largely an endemic disease. Cases occur throughout the year, but the peak incidence is in winter and spring. Epidemic are often associated with overcrowding. But what is mode of transmission? The disease is spreading mainly by droplet infection and after direct contact with an infected person. Incubation period 2 to 3 weeks, usually 18 days. Coming to incubation, clinical features. As you can see, there may be fever, loss of appetite, headache, muscle pain, pain in the ear, jaw and chin, pain when eating, and pain on both sides. As you can see, there is an inflamed one pituitary gland. Simple as it is. So, however, though frequently there are no serious complications, these includes no ovaritis, orchitis, no pancreatitis, meningoencephalitis, thyroid, neuritis, hepatitis, myocarditis. So all this could be some of the problems which you can face during these complications. Coming to the giving an overview of the measles, mainly it's prevented by vaccination. You can see that 1.1 billion vaccinated since 2001. Okay, and uh, just a minute. Just giving you the entire idea of this is given overview. Okay, however, the again the measles is mainly given by vaccination can prevent it, mm, or also by immunoglobulins. Okay, so right, so this you can see as an overview. This is overview of the slide. Okay, right, so that completes the two topics, measles and mumps. Thank you.